My name is Eric Hardwick. I'm a registered nurse. I work in a community hospital. I work on a step-down unit. Step-down unit involves working with patients with heart disease, lung disease. So we specialized in patients who have heart problems and lung problems. Right out of high school, I was pretty unsure of what I wanted to do. And so I was kind of going from job to job, unsure, and eventually was working in a hospital, working as a ER admissions representative, and got involved with working with nursing and become very interested in nursing. And I thought, well, hey, that's something I really like to do. And so I pursued my goal and become the nurse by taking some nursing classes through a college locally. I went to college and got an associate's degree of applied science in nursing. I work on a step-down unit, which involves working with cardiac and respiratory patients. And in order to do that, I got certifications in basic life support and advanced cardiac life support. If you're thinking about becoming a nurse, important characteristics in becoming a nurse would include being somebody who's hardworking, dependable, detail-oriented, very organized, personable, because patients want to relate to you when they're sick. They want somebody to take care of them who is very organized and detail-oriented. What I enjoy most about my career is getting to know my patients. From the time that they walk in the door to being able to see them feeling better and with a smile on their face, ready to go home. The most challenging thing I'd say about my career would be patients that have a difficulty communicating with me, patients who have difficulties with Alzheimer's disease, diseases such as that, or stroke, that patients have a hard time communicating with me, and I have a hard time communicating with them. I would say be my parents. They have taught me to be very personable to people, to be very detail-oriented, and to be a hard worker. And I think in my career, I need those three things are very important in order to do my job and do it successfully. Looking back at my high school experiences and classes, I would say that classes such as biology helped, as well as nutrition and extracurricular activities such as baseball and basketball. The extracurricular activities helped me with being able to work as a team. You need that in the healthcare field. Whether it's nursing or any other type of healthcare field, teamwork is essential. If I was to have to do it all over in high school, I would have taken more science classes, more anatomy and physiology classes, as well as look in the hospital and become a patient care tech or a nurse assistant to help prepare me for this field that I have gone into. Any advice, if there's any advice I'd like to give to students, it would be that nursing is a very rewarding and demanding field. And if you do become a nurse, it's important that you remember that you treat those patients that you're taking care of as if those are your loved ones. And I feel that you will find this career very rewarding. I was taking care of a male patient in his 50s one night when he was resting comfortably earlier in the evening. Around midnight, patient started getting short of breath, started having chest pain. When I went to look at his heart rhythm, identified that his rhythm was in what we call a lethal, deadly rhythm. And so I went in, assessed the patient, was able to perform my assessment skills to the fullest extent, give him medication, and saved his life. Later on, a couple of days later, patient thanked me and was very emotional. I would say that was one of my best times as a nurse.